Hello, Dr. Lewis here, your medical scientist, talking about the coronavirus and what is the right test. And I say our view may surprise you because the testing for whether you're positive or negative provides value, and it certainly provides comfort in those that are negative, but it's not really tremendously actionable in terms of what your next steps are, especially if you don't have symptoms. What I want to talk to you about is testing that can lead you down a path that will increase your odds significantly of overcoming the virus in case you are infected. So let's dive into that. So first of all, let's cover testing as it is today in terms of what the CDC is saying. Testing for COVID-19, which is the disease itself. Not everyone needs to be tested. Most people have mild illness, more than 80%. And a much smaller percent, 4 or 5%, have very severe symptoms, and everyone else is somewhere in between. And these people are able to recover at home without any medical care whatsoever. Isolation, so they're not infecting other people. There is no treatment specifically approved for the virus. Yes, there are a couple drugs out there that have shown some against the virus, but you're most likely not going to get these drugs unless you're really sick and hospitalized, and then the doctor will probably give it to you until they become more widely prepared, available, and proven to have a profound effect on this virus. Otherwise, they're not even considered as valuable as the flu vaccine we have right now, which this year is only 58% effective. Testing results may help to inform decision-making about who to come in contact with. So the CDC is saying you can do this testing, but it may only tell you to quarantine yourself from family members, loved ones, and the general population, but not much more than that. It's symptoms, not test results, that are really driving next steps. You're not going to the hospital if you test positive and you're symptom-free. You're only going to the hospital and getting significant medical care if you have profound symptoms that match up with this virus. Otherwise, you're staying at home. So let's look a little deeper. So what to do after you're tested, and we'll talk about if you test positive in a coming slide. But if you test negative for this, just some facts. You probably were not infected at the time. However, it does not mean you will not get sick, because there's some instances of being not only asymptomatic but negative in the test, but you still may have it. It's possible that you were very early in the infection at the time of your specimen collection, and that you could test positive later. You could be exposed later and then develop illness or be positive. In other words, a negative test result does not rule out getting sick later. So really what they're saying, the take-home lesson, is whether you're positive or negative, everybody has to institute the same precautions so we don't spread this virus to other people, loved ones, family, whatever. So it's just presumptive that we need to be careful about transmission. So what to do after you are tested? So CDC expects that widespread transmission of COVID in the United States will occur. So what they're saying is that in the coming months, most of the U.S. population will be exposed to this virus. So we should continue to practice protective measures recommended by the CDC and others. So the point is, the only advice is to protect yourself. Yet they say most of us will be exposed. Thus, they're admitting their advice is of limited utility. There's nowhere in this advice they're telling you, if you're infected, how to prevent the severe symptoms versus obtaining just mild symptoms from this infection. This is being blatantly neglected. So what to do if you're sick? Obviously, if you have severe symptoms, call your doctor. And there are resources out there that explain the difference between the symptoms of the flu, the common cold, and COVID-19. And it would be useful to be aware of those. We have a video on that already, but that's really the main thing you need to know. So then they just get right back into steps to help prevent the spread. So you're sick, you're positive, but the main goal of the CDC and the authorities is to stop the spread. And obviously, if you have severe symptoms, talk to your doctor. So the CDC is not recommending what to do to reduce your chances of dying from the virus by up to 90%. They're simply talking about not spreading this thing and furthering the pandemic. Now, I want to talk about your individual health and what you can do. So let's just look at, once again, before we go to that topic, looking at what the recommendations are for a positive coronavirus test versus a negative coronavirus test. So let's start at the beginning. Stay at home, except to get medical care if you have severe symptoms. Negative, stay at home or exercise social distancing. Positive, separate yourself from others. Negative, separate yourself from others. Both cases, cover your coughs and sneezes. Clean your hands often. Avoid sharing personal household items. Applies to both, positive or negative. Clean all high-touch surfaces every day. Same thing. If you're positive, monitor your symptoms. And if they get severe, talk to your doctor to see if you require hospitalization, treatment, see if the treatments would be available for you, things of that nature. Now, if you're negative, monitor for your symptoms and know the difference between the COVID-19 symptoms versus cold versus flu. And in all cases, you call ahead before visiting your doctor. And then if you're positive, wear a face mask as recommended. And then ask your health care provider to call the health department and see what action they are recommending based on your symptoms. When I say here, does this set you at ease? Because it's not solving your problem. Very few are getting severely sick, but we all need to improve our odds against dying from this virus. And now the statistics are it's probably more deadly than the flu, but since we have so few tests relative to the number of cases out there, that the actual extent to the increase or the mortality compared to flu may not be as high as we originally suspected, but we don't know for sure at this point. So, how to protect yourself? In my opinion, you need to look at not just isolating yourself from exposure, but you need to enhance your overall health. And what I recommend you do to start is take our simple HIPAA compliance survey on your risks for COVID-19 or being exposed to the virus and what you can do to make yourself more resilient. So here's the URL, and I encourage everybody to take this survey. So what the CDC says, and the reason why we want you to take the survey, is that older adults and people of any age with underlying serious medical conditions are at higher risk from complications and dying from this thing. So older adults, people who have serious underlying medical conditions like heart disease, diabetes, and lung disease. And by the way, there's a report of a 103-year-old getting infected with the virus and coming down with symptoms of COVID-19, yet surviving. So age doesn't necessarily mean it's a death sentence for you. What I think the highest predictive factors are underlying serious health conditions. And that can go across any age. So if you look at this, cardiovascular disease as a condition that you might have prior to being infected increases your mortality to 10.5%, whereas someone with no adverse health conditions, we're really talking chronic conditions mainly, is 0.9%. So going from 0.9 to 10.5 is a 1,200% increase in death from the virus between the healthy and the ill. Okay? And the current flu shot, by the way, is only 58% effective. So if you're relying on medications, vaccines, or treatments, it may not help you nearly as much as going from having cardiovascular disease to overcoming this and going back to having no health conditions whatsoever. So this is Mass General, Harvard Medical School, and what they're recommending for hospitalized patients. In other words, you suspect you have COVID-19, you test positive, your symptoms are mild, you're not going to get this type of workup. This is only for hospitalized people. So they recommend a daily complete blood count with differential, looking at lymphocytes, a complete metabolic panel, looking at your diabetes risk, looking at kidney function, looking at clotting factors, looking at iron storage, looking at inflammation, looking at what I call the batteries of your, how robust the battery of your cellular makeup is. That's what ESR tells me, and some other tests. And I'm here to tell you that you're not going to get these tests from your traditional doctor, but our program offers tests like this to anybody interested in measuring their health. And let me show you what we do. So first of all, there are no really good testing protocols out in the standard of care that measures your state of chronic well-being. We're usually measuring just your acute well-being. Are you sick? We've developed an algorithm called the chronic disease temperature that measures your chronic state of health. And the reason why I have this arrow like this is we all lie on a continuum. The healthiest person in the world is down here, and someone near death is up here, and then all of us are somewhere in between. This is really a measure of your cardiovascular risk, your diabetes risk, your autoimmune risk, your cancer risk, and I'll show you that in a minute. But this is a very simple test of 55 biomarkers, 20 of which we reduce into a number we call your chronic disease temperature, which scales with your internal temperature, but it's not the same measurement. Okay, so here's a sample report, and this is only a partial report. And if you take our lab panel, we're going to give you your chronic disease temperature. But we're also going to look at these various markers: insulin, A1C, red blood cell distribution, homocysteine, C-reactive protein, fibrinogen, SED rate, which Harvard talked about, C-reactive protein, Harvard talked about, neutrophils, lymphocytes through the neutrophil to lymphocyte ratio, so on and so forth, and show you where you are on the diabetes continuum, on the heart disease continuum, on the stroke continuum. So this really gives you an idea of where you are in this continuum, because a lot of people out there are sick, but they're unaware of it. So for example, people suddenly die of a heart attack. They didn't know they had symptoms, yet they were profoundly ill internally without awareness of it. So that's what our algorithm is all about, measuring your risk. So here's how you can get a hold of this risk analysis. We offer on our website, using this link, what we call our comprehensive biomarker panel, the chronic disease temperature and consult. The reason why the consult's important is the testing will reveal the markers, but what is your resolution in case some of the markers are elevated to lower your risk? And the consult will provide you with some basic information on how to start improving your health portfolio and lower your risk, lower your chronic disease temperature. We also offer very detailed testing, RNA testing for your virus burden, because the coronavirus, the novel coronavirus, isn't the only virus that's out there. A lot of people have a viral burden and they're not aware of it. So we'll establish that with this testing. And the other thing is infections, parasites, bacteria will tie up some of your immune system bandwidth and make you more vulnerable to more profound symptoms from COVID-19. So here's another test that we make available. So that's all for today. Dr. Tom Lewis here, your medical scientist, offering you an opportunity to do testing, but not for whether you're positive for COVID-19 or not, but where you are on the health perspective, the health continuum. And then if you test that, we'll give you ways to lower your risk. And this gives you an opportunity to reduce your risk from dying or have severe symptoms from COVID-19 by up to 1,200%. I think that's a really good deal. I hope you got something out of this presentation, and I appreciate your time. Thank you very much.